I don't know if there's going to be enough light. My audience. All right. Turn off light.
Yep.
Okay. I'm gonna talk to you about the H1N1 flu virus. Okay. The H1N1 virus, is it right for you? Why such a big fuss over the H1N1 vaccine? Many of us are concerned with being mandated to get this vaccine because we know little about it. I pulled together some of the facts to convince those whom are still leery about this subject that the new H1N1 vaccine is safe to get. For many of my coworkers, the thought of getting the H1N1 is nerve-wracking. At the same time, it is being mandated because we are part of the healthcare world. The CDC has not provided us with the facts and information to ease our minds. However, I did some searching to help them accept this mandatory vaccine without worries. The H1N1 virus, also known as the swine flu, has many details a lot of people don't know about. The actual name is novel H1N1, which stands for hemagglutinin strain 1 and neuraminidase strain 1. It is normally found in pigs. The H1N1 contains genes from North America and Eurasian swine influenza viruses. This type of influenza has been found to be genetically different and affects children and young adults who seem to have no immunity to this strain of the virus. The first cases of the H1N1 virus diagnosed were back in mid-February of 2009 in Mexico. Within just a couple of months, several hundred cases were found within the United States and other countries. The statistics show that among Americans, 1 in 4 ended up in intensive care and 7% of them died. In the southern part of the world, 14% of flu patients in intensive care also died. Many of them, before getting sick, were young, strong, healthy people. The government is concerned because of the ill or death rates due to this virus since the flu season has barely begun. Many question the way this vaccine was rushed, but it has been brought to our attention that a normal flu vaccine tends to take up to 6 months to produce. As soon as the government officials saw the outbreak of the H1N1 virus and the toll it was taking on our people, they had to act quickly. They were able to find the formula of the virus and the strain so they could start producing this vaccine right away. So in all actuality, it has not taken any less time to create this vaccine as it would of any other flu vaccine. Some other concerns are, have there been any trial tests for the safety of this new vaccine? Even though the FDA does not require clinical trials to study all new vaccines, there will be trials conducted on the H1N1 vaccine. The first to get this vaccine was China. Of the 39,000 people vaccinated, only 4 had side effects of muscle cramps and headaches. Dr. Thomas Frieden, the CDC director, stated, "We have not cut no corners." The U.S. government ordered and paid for 251 million doses of the 2009 H1N1 vaccine. That means it will be free of charge to those who receive this vaccine. However, the facility may charge a small administration fee. They have also purchased supplies such as syringes, needles, and sharps containers at no cost to the citizens. This is their way of relieving some of the healthcare costs we endure when it comes to getting vaccinated. After carefully monitoring those who have been diagnosed with the H1N1 virus, it has been said that the most vulnerable to contract this virus are children and young adults. And unfortunately, it has had a high fatality rate in pregnant women. It does not seem to be affecting the elderly, whom are generally one of the main targets for an influenza virus. Pregnant women are at higher risk because during pregnancy their immune system is compromised. This makes them susceptible to catching a cold or flu virus very easily, and it also makes it harder for them to fight it off. Many people with a suppressed immune system do not generate an immune response. Therefore, the H1N1 virus or any flu vaccine would not benefit them. These people would be cancer patients receiving chemotherapy, asthma patients who are on large doses of steroids, and those patients who take immune-suppressing drugs after an organ transplant. After going through all of this information provided to us, you have to ask yourself, as a healthcare worker, am I willing to infect thousands or millions of innocent people? This is not a question anyone should be able to answer yes to. We as healthcare workers have signed up to care for and honor those who are sick or injured. The healthcare world is already in high demand of more workers and cannot afford to lose any workers to this virus. Even if it were just 1 week till they recovered, it would make a huge difference in the level of care a patient is provided. As healthcare workers, you need to consider the right choices in order to effectively perform your job duties without anything getting in the way, if it is preventable. A majority of hospitals, nursing homes, doctors' offices, and even schools are mandating this new H1N1 flu vaccine. A lot of people are upset because they feel it is a breach of their constitutional rights. However, if I were to care for your loved one and had contracted the H1N1 flu virus, would you want your sick, vulnerable loved one to also contract it? I don't believe anyone would want to be the cause of another person's illness, which could also lead to their death. The government and the CDC have proven that this vaccine was produced just as if it were the regular seasonal flu vaccine. They have also done trials to show us that there is nothing to fear. As healthcare workers, we have a duty to protect ourselves, our patients, our friends, and our families. So with this question in mind, H1N1, is it right for you? Should be yes. Only if you are allergic to egg products should you avoid this vaccine.